it's not permissible to me as a doctor to use a device that is so convincing in its outputs that makes even occasional mistakes that could harm the patient. Because obviously, as a doctor, you've sworn to do no harm, so that's one of the first tenets that you act by. And if ChatGPT or a large language model was a doctor, that'd be a terrible doctor, because they're giving such bad advice from time to time.
Yeah.
And it breaches one of the fundamental roles of what a doctor or a clinician should be.
So again, I agree with everything. And my question in the end is just like, is there a way for us to make it safer? What advice, what can we do to make it safer? Because no matter what we say, people are going to use it. And I don't know, is the right way to do it just to use both the large language models and Google to try to learn about your condition, to try to understand maybe your condition better, to try to...
Yes and no. It depends on the person's education. Like, what medical knowledge do they already have? I've met some people who are very understanding of different health conditions, and sometimes it's cultural, but I've also met people that completely have no clue about their own conditions. So that's where it's dangerous, because you don't know what you don't know as a layman, and you don't know when it's giving terrible advice. I would say the best solution is what we've been trying to do, which is doing more research in this area, and also the grand aim of building a large language model that can be used by patients and clinicians alike. We did fine-tune the NHS large language model, but the implementation is the problem. So then that boils down to regulators and funding and the just entire kind of AI infrastructure and health infrastructure in the UK. So it's all a cycle, right? What you're seeing when patients are using Google or using ChatGPT, that's just a manifestation of a struggling system, right? That's the problem.
Okay, no, with that I completely agree. So basically what we want is put more into research, put more into validation, everything that we were speaking about last week, which is the regulation around these models. We want to put more into AI safety so that we are sure at least these models that we put out, that they will do no harm, or they'll do as little harm as possible. So we simply need more validation of these models so that when people eventually end up using them, and they will, that we can be at least sure that they are doing very little harm. And
twofold as well, right? Twofold. So education, so validation of the models, yes, and education is so important for both the patients and the clinicians to know the limitations of the model and to understand, when it's giving a bad output, when you should trust it and how you should interact with it. So that's kind of global AI literacy.
Yeah. And this is maybe a bit off topic, but do you think, or do you prefer when patients also get educated on their own disease, when they learn about their own disease? So like read medical literature, read papers. Is that something good or bad?
That is great.
That's great.
I mean, every patient, it's easier said than done, because it boils down to so much as like nature and nurture, like your mental capacity, your upbringing, your culture, like we said. But the patients that take an interest and an understanding in their own disease, I mean, they're gonna do better. Like, if they understand what the medication is for, how they should take it, and they take a proactive approach to health, that's amazing. Like, those patients are great because they ask the right questions and they take the right actions. And you know, that's important. So that's just going back to the education. It's important from a health perspective, and if they can have that knowledge and apply it to Google or ChatGPT, that is also great, because then they know how to interact with these models.
That's perfect. Basically, like, that's exactly what I was hoping to hear. I was not sure what are you going to say, but that's exactly what I was hoping to hear, because that also means that if we make these better models, if we make higher quality models that can provide real medical information, then it means those models can help patients. If they can provide like real data that can teach someone about their disease, the models should maybe then not be there to really diagnose or recommend stuff. There should be more there to educate and like teach people about their condition, about what's happening, about everything. And then again, in combination with the doctor, it can be a perfect synergy.